Hello, my name is Rachel Forrest, and today we'll be talking about emotionally focused couple therapy. First of all, we're going to go into the history. So the history is it is an EFT. History of EFT is it is observational, empirically supportive, integrative, experimental approach to treatment. It has elements of Carl Rogers, person-centered therapy, Gestalt therapy, experiential therapy, and existential therapy with modern emotion, cognitive, John Bowlby's attachment, interpersonal, psychodynamic, and narrative theory, and dialectical constructive metatheory. Originally termed process experimental psychotherapy, it was used initially to describe the EFT couples therapy approach of expressing underlying vulnerable emotions. Though it's important to distinguish, there are two types of EFT models. So motion or emotionally focused couple therapy under the acronym EFT have similarities but are different models, known respectively as emotionally focused couple therapy by Sue Johnson and emotion focused couple therapy by Leslie Greenberg and Rhonda Goldman. Sue Johnson is where we talk about it being more of an attachment-based therapy. So it's attachment-related emotions and needs. Leslie Greenberg and Rhonda Goldman focus more on emotions and personal needs related to self and the relationship. There's types of EFT. There's EFT for couples, EFCT, EFIT, which is emotionally focused individual therapy, EFFT, which is emotionally focused family therapy, goals in EFT are there's goals in EFT for couples, goals of in EFIT for individuals, and goals of EFT for families. So we have goals in EFT for couples is to expand and reorganize key emotional responses and in the process, the organization of self, to create a positive shift in partners, interactional positions and partners, to foster the creation of a secure bond between partners. And the goals of EFT for individuals is to offer corrective experience that positively impact models of self and other and shape stable, lasting change. To offer transformative moments where vulnerability is encountered with balance, engagement that characterizes secure attachment with others, to enable clients to shape a coherent sense of a competing self that can deal with existential life issues and become a fully alive human being. Goals of EFT for families is assessing and expanding awareness and of unacknowledged feelings associated with the family's negative pattern, reframing family distress and child problems within relation blocks, reinforcing this distress, promoting awareness and assessing and access to underlying caregiving attentions and disown attachment-related theories, facilitating the sharing of unmet needs and effective caregiving responses. Strengths of emotionally focused therapy, EFT is based on clear, explicit, research-based conceptualizations of individual growth, health, and dysfunction of a relationship and of relationship distress and adult love. EFT is collaborative and respectful of clients, combining experiential Rogerian techniques with structural, systematic interventions. Change strategies and interventions are specified. And then key moves and moments in the change process have been mapped into 3 stages of therapy and key change events that predict success at the end of therapy. EFT has been validated by over 30 years of empirical research. There is also research on the change process and predictors of success. EFT has been applied to many different kinds of problems and populations. There are in EFT, there's distinction made between 4 different emotion response types. Primary adaptive emotion. Person responds adaptively to information from the environment to enhance well-being and survival, such as feeling sad at loss and seeking comfort as a result. Maladaptive emotion is origination in harmful, dysfunctional environments, while adaptive to that environment are not adaptive to other environments. Secondary reactive emotion is learned responses for when primary responses are not acceptable, and instrumental emotion is acquired through negative responses and experiences as a way to control and manipulate the emotions of others. Other important concepts are emotion schemes provide the building blocks of self-organizations. When positive, it allows us to process and regulate our emotions and feelings effectively, allowing us to flourish. However, when negative, our emotional processing and regulation capacity is reduced, leading to more dysfunctional ways of coping. Differentiation of self and others is an important concept as well. The EFT process is a transdiagnostic case conceptualization of a moment-to-moment emotional processing in session. The quality of their organizations, their understanding of their life histories, and the extent to which they are goal-directed, active agents with adequate levels of differentiation between self and others. Use clients' pain as revealed in the life stories and in their session behaviors to guide their formulation moments to moment and over the course of treatment to transform emotion schemes which open up new ways of perceiving, experiencing, and behaving, allowing clients to transform their pain, develop more satisfying ways of being that allow them to thrive. Therapists' client markers try to identify clients' problematic emotion schemes, listen for unmet core needs, attend to clients' expression of secondary emotions and their options to emotional processing, as well as broader themes that reveal clients' more characteristic ways of being in the world. Emotional processing is an important process of the EFT process. EFT methods are listening to client stories, empty chair dialogue, focusing, as seen in this image of EFT tapping. Focus from the outward to the center of their bodies, focusing on what they are aware of, sensations, thoughts, and feelings. Then they identify one issue or a sense to focus on, and then they find a label or description that fits within their bodily experience. So this is important for people that are not able to identify their emotions very well. Systematic evocative unfolding. Client tells story in detail and therapist tracks when the emotion was triggered. An intervention named EFT Tango is of mirroring present process, affect assembly and deepening, choreographing engaged encounters, processing the encounter, and integrating and validating. How the client is viewed and how change occurs. Therapists apply different techniques to facilitate clients' access to emotions and resolve problematic aspects of experience in terms of their self-organizations, shift how they interact with others, and refine their understanding of themselves and events. Follow the therapeutic relationship as described by Carl Rogers. They are attentive, curious, accepting, and fully immersed in their interactions and moment to moment with their clients. Being genuine does not mean that therapists reveal all their feelings to their clients, but rather that they are aware of their feelings and do not pretend or deny them to themselves. 3 guides to emotional processing in a session: the awareness, transformation, and regulation of emotion. Using empathic reflections or response modes. Alliance repair dialogues, self-soothing dialogues, and narrative expression tasks. The alliance rupture dialogues act quickly to reflect their client's reluctance, resistance, withdrawal, or hostility, and actively listen and validate what their clients are sharing. Self-soothing can be used in empty chair. Narrative expression tasks include markers that include shifts in narrative or highlights of life stories, and micro markers that indicate engagement in therapy. Population best served is used for treatment for depression, anxiety, complex trauma, eating disorders, and personality disorders. It has been adapted and used with individuals, families, and couples. There are other types of neuroscience research available for emotionally focused therapy. In this study, it is using hand-holding. The colleagues argued that proximity to social resources regulates negative affect by buffering the perception of threat. It uses functional magnetic resonance imaging for this study. Women in the highest quality relationships showed strongly diminished threat-related activations throughout the brain. Women in lower quality relationships did not realize the full regulatory impact of hand-holding, and they had even less regulatory effect attributable to holding hands with a stranger. However, facing the threat of shock alone caused the highest level of threat-related brain activation, which does mean that hand-holding or the positive association, even if they are not high-quality relationships, does have a positive effect. And that is it. Thank you so much.